Imagine checking your post one morning. Among the usual letters, you notice a small package from the NHS. You open it. Inside is a kit asking you to collect a tiny sample of your stool. Most people have the same reaction. I feel completely fine. I don't have any symptoms. I'll do it later. And unfortunately, many people never do it. But what if I told you that this simple home test can detect signs of bowel cancer before you even notice a single symptom? And today, I'll also explain something that surprises almost everyone. Why do thousands of people receive a positive result every year, even though most of them don't have bowel cancer? Let's find out. First of all, why is the NHS sending thousands of people this test every year? The answer is simple: because bowel cancer often develops silently. It can grow for months, sometimes even years, without causing any symptoms at all. By the time someone notices bleeding, weight loss, persistent changes in their bowel habit, or abdominal pain, the disease may already be at a more advanced stage. That's exactly why screening exists. The goal isn't simply to find cancer. The goal is to detect problems early, or even prevent cancer from developing in the first place. What is the test actually looking for? Now, here's something many people don't realize. The test is not looking for cancer itself. It's looking for something much smaller. Tiny amounts of blood in your stool. Blood that you cannot see with your own eyes. This test is called the FIT test, which stands for Faecal Immunochemical Test. Sometimes bowel polyps or an early bowel cancer can bleed in microscopic amounts. The FIT test is designed to detect that hidden blood. Does a positive result mean cancer? This is probably the question everyone wants answered. If your FIT test comes back positive, it does not automatically mean you have bowel cancer. Let me say that again. A positive screening test is not a cancer diagnosis. In fact, most people who receive a positive FIT result do not have bowel cancer. So why can the test be positive? Because blood in the stool can come from several different causes. For example, hemorrhoids, inflammation, small bowel polyps, or other non-cancerous conditions. The test simply tells us blood has been detected. It doesn't tell us why, and that's why further investigation is important. What happens next? If your FIT result is positive, you'll usually be invited for a colonoscopy. Now I know, the word colonoscopy makes many people nervous. During the procedure, a doctor uses a thin, flexible camera to examine the inside of your bowel. If they find a polyp, it can often be removed there and then. And that's one of the most remarkable things about bowel screening. Removing certain polyps can actually prevent bowel cancer from developing in the future. What if they find something abnormal? If the doctor notices an abnormal area, a small tissue sample called a biopsy may be taken. That sample is then sent to a laboratory where specialist doctors examine it carefully under the microscope. This allows doctors to determine exactly what the tissue is, whether it's completely normal, a harmless polyp, a precancerous change, or cancer. Scans and cameras can show what something looks like, but in most cases, a biopsy provides the definitive diagnosis. Why screening saves lives? One of the biggest reasons bowel cancer treatment has improved so much is because more cancers are being detected early, sometimes before they cause any symptoms at all. When bowel cancer is diagnosed early, treatment is often less extensive, recovery is usually better, and the chances of successful treatment are much higher. Who should do the test? So, if an NHS bowel screening kit arrives through your letterbox, please don't ignore it. It only takes a few minutes to complete. It could provide reassurance, or it could detect a problem early enough to make all the difference. Remember, finding blood on a screening test does not mean you have cancer. It simply means the bowel needs to be examined more closely. And that's exactly what screening is designed to do: to find problems early, treat them early, and in many cases, prevent cancer altogether. If you found this video helpful, please like, subscribe, and share it with someone who may receive an NHS bowel screening kit. And if you'd like me to explain what happens during a colonoscopy or how a bowel biopsy is examined, let me know in the comments. Thanks for watching.